Last check off. Okay, here we go. So I'm going to start by looking at her shoulders. I'm going to inspect it. Obviously, the patient would be just having their drape on where you can look. You're just going to look for any signs of abnormalities, swelling, how they're presented, if her shoulders are both bilaterally symmetrical, just anything abnormal. And I could start by palpating. So I'm going to start up here. I'm going to palpate and go down, and then move my way across. Same on the other side. And move my across. Alright. Any pain when I did that?
Mm-mm.
Okay.
Nope.
So no pain, no swelling, no tenderness. So I'm going to ask you to flex. So you're going to bring your arm up and then extend it back. And then you can internally and externally. And then reach back. And then go adduct and then abduct. Okay. And now with the other one. Just do the same motions. And back, flex. And then you can come across. And then reach behind like you're itching your back.
Mm-hmm.
And then adduct. And then, yeah. Okay?
Mm-hmm.
Good. Alrighty, so no signs of abnormalities. So then we can start with the elbows. You would inspect them, looking for any nodules, thickening while you're palpating it, swelling, pain or tenderness while you're doing it. So you're going to feel those. So it feels everything bilaterally symmetrical. Okay.
Mm-hmm.
Alright. Any pain or tenderness?
Mm-mm.
Okay. And I didn't feel any thickening, so her elbows seem good. So then we're going to start, just do the motions. And then bring it in. Just do all the movements. And now the other side.
Yeah.
Externally.
Mm-hmm.
Got it.
Mm-hmm.
Alrighty. Looks good. So then I'm going to move on to the wrist and hand. You can just kind of look at them bilaterally, looking also for any abnormalities, how they're positioned, the movement of the fingers. They should be slightly flexed, just, swelling of the joints, any deformities or abnormalities. And then you can start by feeling the wrist joint. And the Doni processes it with it. Moving down. And then feeling the joints. And same thing. Feeling abnormalities. Okay, so then as the movement, so flex and extend, and then your finger movements as well, and make a fist. Just do all that with both, so that's good.
Mm-hmm.
Bring your thumb across and back. Same for both.
Mm-hmm.
That's good all there.
Mm-hmm.
No swelling, no thickening of the joints. All the movement is present, so that's good. And then moving on to the spine. Turn around and just. So once again, the patient would just be not have anything back here, but this patient is non-compliant. So you would just make sure that the head is bilateral. Look at their orientation, their gait. You know, if it's bilaterally symmetrical, the head should be midline. Let's see, what else? Posture of the neck and trunk, she should be erect. Neck movements, midline. So, and then you want to identify the spinous processes of C7 and TI, which is more prominent when they're actually, when you put your, just like right there. So, that's good. And then, you want to, flex and extend your neck. Okay, now tuck your neck in. And then can you turn your head from back to forward. And then lateral movements. So kind of act like you're putting your ear to your shoulder blade on the other side. Okay, so that's all good there. Also, I'm going to look for the muscles on the side, paravertebral muscles. So they're just going to be right here on bilateral sides. Just want to look for any abnormalities, especially when you're palpating them. And then I'm going to go to the iliac crest, which are basically the skin dimples at the very lumbar region of the neck. So you just want to basically look at the cervical, thoracic, lumbar regions of the spine. And then just palpate each of those. And you want to start with the thumb over the lumbar and then go down each one to make sure none of the joints step off or no pain or swelling, because people can have a lot of lower lumbar pain. I can't really reach hers, but do the hip joints. Look for any skin tags, lesions, masses, just anything abnormality, especially when you're feeling the muscles on the side. And just go down the spine, make sure the curvature of the spine is straight. And the dimples are right here. And then you fill down for the iliac crest and the anterior superior. So good. So then you could, will you stand up? And then touch your toes. Okay, and then hyperextend your back. You can stand back up and hyperextend. And then can you do lateral movements? So just move from side. Yep, and now the other way. Yep. And then, so that's good. Yep. So, and I basically just already palpated the hip. I was moving on a little fast. So when you do look at the hip, you want to just look how they're walking, you know, how their gait is, swing, atrophy, any bruising. So that's how you want to look at that. And you would start by palpating the iliac crest, which is at the top of the hip, and then go into the tubercle, and then the posterior crest and spine. So you feel down there and kind of go around. You could either go on the back side. The pubic symphysis, just look for any signs of swelling, nodules, masses, any sort of pain, discomfort when you're palpating that. So for extension, you would need to lay down.
Yeah.
Yeah, so just say she was laying down, that's fine. So bring your knee up each side, yeah. And then internal, so bring it in. Another one. And then out. Okay. And then you can just move your leg up. Everything's good there. So no masses, anything of that nature. So for looking at the knee, you would want to have them in a position inspect any, just the contour of the knee, if there's any swelling, thickening, if it looks bulgy, just anything abnormal at all. Because people can have a lot of knee pain and
Mhm.
problems. Also, when they're walking, you want to look to see like how their gait flow is, smooth movements, everything like that. So to palpate it, you can start at the sides and just kind of go down to the patella and feel it.
Mhm.
Any signs of abnormalities, any tenderness, pain.
Mhm.
Okay. So sometimes I can have thickening, irregular bony provinces, none of that nature. So then you can extend your knee
Mhm. Mhm.
and then bend it, and then bend it.
Mhm.
And then to fill the sub patch, you can squeeze the sides of the knee,
Mhm.
see any bulging. Okay. And then you can bend your knee and bring it in again.
Mhm.
That's inversion and exversion.
Mhm.
Okay, so looks good there. And lastly, we have the ankle and the foot.
Mhm.
So start by feeling the ankle and moving down
Mhm.
and then the tarsals. And then feeling each one with your thumb on the foot and then next. Not to hurt the patient.
See it.
Same. So ankle, moving down, and same thing, feeling each one.
Mhm.
Okay, all feels good. You want to look for any calluses,
Mhm.
corns, nodules, swelling, deformities of any nature, which I've seen her feet multiple times and they're fine. So then to flex it, you want to point your toe to the floor
Mhm.
and then extend it up. Yep, another one. And then move your heel towards midline and then away. Yep. Now the other one.
Mhm.
Alrighty, so that's good for all the joints. So now to test her cranial nerves, I would go ahead and do all that. So for the oculomotor, the third one, I would go ahead at this point and take a pin light and look for perola. They're going to constrict, so pin light, it would be dark. Make sure her pupils are equal, round, reactive to light. Constrict everything. She can blink her eye, move her eyes, so making sure she can look in all the 6 cardinal directions. So look around. Not moving your head, just look.
Oh.
Yes.
Mhm.
That's good.
Mhm.
Okay. So that basically goes for the trochlear too, for that one, the 4th one. So then for the 5th one, the trigeminal, can you clench your teeth really hard? Move your jaw. I'll want to palpate. Move your jaw back and forth. Like a, touch your cheeks. Move your jaw.
I'm trying.
Okay.
I tried.
Okay. Having a brain fart. Sorry. Okie dokie. And then the corneal reflex is when the patient is just looking, and you come in an opposite angle and actually touch their cornea. They should obviously react to that. So I'm not going to do it to you because she has very sensitive eyes.
Mhm.
So then the facial, can you raise your eyebrows, frown, smile, and then close your eyes really, really tight together. Really tight. Really tight. Squeeze. Okay. And then you could try to open her eyes. Show teeth, both bottom and lower. Okay. Puff out cheeks. Okay. And then the next one is acoustic. So then it's a whisper to make sure she can actually hear me, the whisper test.
Okay.
What did I say?
Hello? Hello?
Okay. All right, and then you have your 10th one, or yeah. So then you have your 1X and glossopharyngeal, so 9 and 10. So it's the glossopharyngeal and vagus. So basically, you just want to listen to their voice and watch them swallow and that say ah for me, and then just talk.
A little.
Okay, so no hoarseness or anything of that nature. And you'd also check their gag reflex at this time. Make sure they swallow okay. No other signs of stress when they're swallowing. And then you have the spinal accessory one. So I'm going to hold her shoulders and then just move her this like that. So she's able to turn her head. So that's good. And the last one, hypoglossal, you're going to look for any abnormalities with the tongue. So just make sure it's midline, not swollen anything, that they're able to move their tongue back and forth, up and down. So stick it out and then back side to side, up and down. Yep. Okay. Looks good there. Okay, then moving on to the rapid movements. So this is basically testing her movements. So pick your finger like this and just tap really fast. So you just want to look for the rhythm, the movement, if they can actually do it first off, everything like that. So, and then now the other side. And then you can do the same thing with the hands go. Now turn your hand.
Am I doing it faster?
Faster. Okay. So she's good there. And also you could check with her. No, you tap my hands with your feet. Really fast. Okay, so that's good there. And then point to point. So basically when they, alternating. So I'm going to have my finger here, and you touch my finger, and then yours. But do it so it's like, so you can alternate, So put your hands out like this, and then touch my finger then to your nose, and then now alternate it. So do that one now, and now that one. Yeah, keep doing it.
I'm not very coordinated.
So you would basically do that, and then you could do the heel test, shin test. So basically, you put your other leg out, put it straight. So you're gonna take this heel and cross it and come down like that, but touch your. Okay, now do the other one. Yep. So we do that a lot, and I know in stroke patients too, to make sure all their cranial nerves are
Working.
intact. Yep. So let's see what we have next. So go ahead and walk across the room for me. I'm gonna assess the gait. Make sure she has a normal gait. I'm gonna do it right here so you can see. Okay. Now walk heel to heel. So just hit on your heels. Walk on your heels.
Almost like this.
And now on your toes. Okay, now walk heel toe, like one in front of the other, like that. No, like put
Like
in a
this?
straight line, yeah. Like if you were
Yeah.
getting a DUI. 1 to 1. Okay.
Okay.
Alright, so. And then hop in one place.
Hop in one place.
And now on one foot. Now the other one. Okie dokie, so that's all good. So then you could do the pain light touch. So basically at this point you get an object that is a lot more sensitive than, so I could do like the end of this pin, and I would basically show her beforehand and touch it. So this is what it feels like. So it said in the book to, do it in certain places, like on the shoulders, the forearms, the thighs, the feet, the just places to do it best. And then obviously you want to do it bilaterally, and then you do it with light touch, obviously with like a cotton ball or something. Not as bad.
Yeah.
So I would have basically test her, and it's gonna take. I don't want to use up all the time, but I would do all that bilaterally. Ask her what kind of pain it is, etc., and then do it with this and see if it's the same sensation. Obviously, her eyes are going to be closed, and just she can tell the difference between the two. And then moving on to the proprioception. So that's basically, let me see your toe, feet both up here. So it's when you grab their big toe and you tell them what it's going to feel like. You pull it up and down. So you have them close they close their eyes. So go ahead and close your eyes. And then you ask them, so which way am I going up? Which way am I going?
Up.
Yeah, and which way?
Down.
Okay. The same thing.
Up. Down.
And you can also do it with their upper extremities, like I would do it with their thumb. Up, down, etc. So just like that for the proprioception, I can't say. And then for the discriminative sensation, this is when you test aeruginosis. So that is, I know one of them. So I can ask them, something they often see a lot or feel a lot, and we'll just do but see, there's number identification, so you'd actually draw a number on their hand, and they would tell you what it is. So I would do that on both hands and see, with the marker, I could do touching the patient on both sides bilaterally, just somewhere touching or at the same time, and ask where they feel. They should be able to tell you. Give them an object that they often recognize. This is what I was talking about earlier. Put it in their hand and see if they can recognize it. Let's see. And then you can do point localization, where you actually point on or touch them somewhere on their skin, and then you would ask them to tell you where that you actually touched. So, the main one is aeruginosis, where, like I said, give them something like this where they deal with a lot, put it in their hand when their eyes are closed, and then see if they can identify it. Lastly is your reflexes. So you have your biceps reflex. So you want their arm flexed a little bit, holding right here. And then, you'd strike it right there, and you'd want to feel that muscle. It should flex right there, and you would do it bilaterally. And then for triceps also, like that, and you would hit it just like that, and you would want to feel it flex. And then you're going to do patellar, or no, you want brachioradialis next. So it's basically your forearm, so you would have a little bit flex and hit it right there, and feel it flex, which I did. And then same with your knee, patellar, and then the other side, patellar. And then you would do Achilles, which is the back, kind of hard, like that. And then on the other side. And then obviously on a scale 1 to 4, overactive, underactive, which you don't want over or under. And then you have your plantar, which is testing for Babinski's, and you want them to curl in and not curl out, because that's positive. So you don't flex it, just keep it normal. So she should curl down, her socks. And then I would do it on the same side. So that is all for this assessment. And it was a lot, but I tried. Alright, thanks.